The official kickoff was August the 8th, and we had over 200 volunteers out and delivered literature in the entire constituency. So today we're doing another literature drop, and we have the volunteers out delivering to all of the homes in the constituency. And I'm door knocking, of course, because I want to try to meet people as much as I can. Yes, there's a lot of dissatisfaction with the current situation. People are worried about the economy, their own personal financial welfare, and they're also worried about the province's financial situation. So I think that's the number one problem that is on people's mind. We've gone into a recession without any preparation for it. Shouldn't have been a surprise. The commodities market is always variable. If you've lived in Alberta a while, you've seen how that goes over the years. So we should have been preparing for that instead of squandering the opportunity that we had with the surpluses over the last 10 or 12 years. So that's the number one issue. After that, healthcare, seniors issues, the environment. I think those are the main issues that I've had. Last night on the door, a woman was saying to me she was totally concerned about hospital care, what was going to happen. And that is, I want to be clear, and I hope you'll say this, I want to be clear that healthcare workers are doing the best they can and fantastic jobs under difficult circumstances, but the lack of resources is extremely difficult. And if you've been following the H1N1 issue, you know that there are no extra beds, there's no wiggle room in the system. And, we live in a first-world country, but we have got some problems with access that are very severe. And people are worried about that. They're worried about spending hours in the emergency waiting room. Another person told me yesterday they knew that people just left because, or didn't even go. They just stayed home with abdominal pain or chest pain because they knew that it would be such a long wait. We have got to do something about that. It's just not acceptable. So I think there are some of the issues that are on the door right now. Absolutely, I hear that again and again. Yes, there is a lot of discontent for sure. We've got a lot of volunteers out working and door knocking and delivering literature. And the other thing that we are doing is we are having a very active online campaign. Difficult to reach people. We have to use all the means we can. So we've got an active online campaign with videos that we're putting up and which we'll be continuing to do on different issues, with blogging going on, Facebook, Twitter, and so forth. And I think for the younger generation who've grown up with computers as a part of their everyday life, this is the way to reach them. We're going to use every method possible, and certainly, as you know, Calgarians are incredibly active people. If you go to their door in civilized hours, they're frequently out, but we are doing that. We are doing the door knocking, but we are really going to be using the internet and all of the electronic methods to reach people as much as possible. We really want to engage people in the notion of democratic debate, of discussion of the issues. I think we have a wonderful opportunity here. There's a lot of dissatisfaction with this government, and I think people know that I stand for the public interest and have done publicly for some years now, and I think we have a very good opportunity here. Number one is the economy and their concerns about their own jobs and what kind of cutbacks this government is going to force on us now because they have not prepared for this day. They did no preparation for this day, and the Alberta Liberal Party kept saying, save the surplus, save the surplus. You know the commodities market is fickle and is at the mercy of factors completely outside of Albertans' control, of hurricanes and wars and international pricing that are outside of our control completely. This government should have been preparing for that all along. In the 90s, where did the cutbacks happen? Healthcare and education. And we're seeing that again. We're already seeing closures of beds at Alberta Hospital Edmonton. And by the way, mental illness is the main reason for sick time, time away from work. But it's the poor sister of healthcare. And whenever they say that they're going to cut acute beds and replace them with community resources, it doesn't happen. I've lived through that too in my lifetime. So you see that already happening. It happened without any consultation with the psychiatrists in Edmonton, the caregivers at all. Then we see they've removed the paramedics from the emergency room. Well, it's not the emergency room, from the hallways in the emergency room. And I think that people should be gravely concerned because it seems that the main issue for this current Health Services Board is to cut costs without providing better care. And the main focus should be on providing first world excellence in care to people. I know that people who are heavily involved in oil and gas have said that it's the unpredictability of the royalty regime that really makes it very difficult for them to plan for the future. But I would also say, unfortunately, with the price of natural gas where it is today, it is way more expensive to look for it than it is to sell it. It's just, it was, what was it yesterday? $2.90, I think. So that is really hurting the people who are working in natural gas production. And you see, the government should know that these things happen. Since we've lived here, we have seen the price of oil and gas all over the place. You can't just spend everything you get in the good times and have nothing left for when the commodity prices go down. So you can't just spend all of the profits that you make in the good times and think that the commodity prices aren't going to vary. I mean, they do vary. Historically, they vary a great deal. You remember last summer when it was 140, now I'm talking about oil. Oil was $140 a barrel. The next thing it's $50 a barrel. So you cannot count on a predictable market. So you mustn't squander all the profits that you get during the good times. This is no way to run a government, particularly one that is financed by the commodity market. I mean, what got me personally into politics was healthcare, because I saw the devastation and the destruction that was happening, the lack of forward planning. You know, I mean, they blamed it on the population growth. Well, the population didn't grow by 400,000 in a year. From 1980 to now, it's grown by over 400,000 people. So it was happening every year. You can't just say after 10 years, oh, we didn't know it was happening. So we were watching the complete lack of planning, the devastation, lots of high incomes at the upper end of administration, and not enough support at the front line. I think as far as healthcare goes, we need to be looking at really innovative, well, there are some innovative things going on, but they need to be increased, such as the primary care networks. We need to have a pharmacare program for the province and for the country, actually, because that's the fastest growing cost, is the cost of pharmaceuticals. So that needs to be engaged. We probably are going to need to look at some different sorts of professionals looking after people, because primary care is very under-resourced at the moment. And I think we should be focusing on that. We should be focusing on making the emergency room more efficient. I'm sure that can be done, but you have to put your focus on that instead of arguing about who should pay and how they should pay. We can be using other professionals up to their level of professional expertise, nurse practitioners, technologists. There's a lot of things that could be done, but somehow the focus doesn't really seem to be on the front line. And you know, we're having the third reorganization of healthcare administratively in 15 years. I can't imagine what that costs. I mean, the costs of moving the furniture around at the top are very expensive, but it's not changing anything on the front line. All right, thank you.